I'm really happy to be here and to share some of the work that the GMSH is doing related to harm reduction and gay men's health in the context of party and play, which we define as the use of particular drugs, mainly crystal methamphetamine and GHB, before or during sex. Before I get into things, I'll just give a quick background on the GMSH in case some of you are not familiar with our work. We're a provincial surveying capacity building program based in Toronto. We're funded by the AIDS Bureau at the Provincial Ministry of Health to support the work of 28 community-based HIV service organizations that make up our alliance. So through our efforts, we're seeking to optimize the engagement of 2S GBTQ men across the HIV prevention, treatment, and care cascade. We do this in a number of ways, including the development of trainings, guidance documents, and other resources, working with academic partners to translate research into action, developing social marketing campaigns, and convening stakeholders with an interest in gay men's health. The members that make up our alliance provide critical services across the province in the realm of sexual health promotion. These include education, PrEP linkage and navigation, HIV and STBBI testing, and linkage to HIV care. And they also work to inform that there is a more informed, gay competent local service network for gay men to tap into. Underpinning all of these activities is the online delivery of sexual health promotion on apps and hookup sites, which in many regions of the province provides a direct link between the organization's service offerings and where gay men are. The majority of organizations that make up our alliance have harm reduction programs. These primarily receive their funding through our funder, which also funds Hep C outreach teams, Ontario's HIV testing program, and a range of clinical and community-based organizations. So there's a total of 30 programs providing harm reduction services to people who use drugs. And these include harm reduction teaching, the distribution of supplies, and referrals to treatment, health, and other social services. Demand for these services has increased year over year, especially as Ontario grapples with the opioid crisis. You can see some examples of the service delivery approaches of these programs, and while they have had success at engaging populations who use drugs, populations on the margins, we lack a solid understanding of the relevance, access to, and use of harm reduction programs by 2S GBTQ guys. Especially given that guys who P&P experience dual stigmas related to both their sexual identities and the context of their substance use. So as a starting place, we recognize the following about harm reduction, and these shared understandings have been born out of years of social and scientific research, service provision, and above all, the experiences of drug users in communities. So the history of syringe access in Canada, activism related to the response to the opioid crisis, a commitment to social justice. Following in this tradition, we think it's critical that any access point to harm reduction knowledge and supplies for gay men amplify their voices and their involvement. It's important, though, that we recognize the significant disconnect between mainstream harm reduction programs and the lives of gay men who party and play. Staff who mainly serve heterosexual opioid-using populations may not have the same knowledge regarding the types of substances used and its related cultural affiliations. And we believe that our gay men's sexual health programs in our alliance are uniquely positioned to champion harm reduction among gay men through a lens that is sex and pleasure positive and informed by lived experience. So it's through these efforts that we're supporting our alliance members to implement a range of harm reduction approaches in a way that's informed and defined by our community. Importantly, I think gay men have always practiced harm reduction. It's not something that was given to us, but rather a way of navigating our sex lives in an epidemic. Harm reduction in our communities is much more than the distribution of supplies and barriers to reduce the risk of bloodborne infections. It's about community care, strategies that are shared amongst trusted social and sexual networks, about the things we do for ourselves before, during, and after partying. And it's about how we safeguard our boundaries and tap into our resiliencies, and ultimately about the autonomy over our lives and our choices. Mainstream harm reduction programs may never be equipped to meet guys where they're at. So think for a moment about party and play, the motivations of guys who participate in it, the spaces in which it's organized and takes place. I especially love the resource on the left side of the screen, It's adapted by Mainline, which is a Netherlands-based NGO committed to the health and human rights of people who use drugs. And their Safer Slamming resource was based on research within communities of guys who inject drugs during sex. It uses colloquial languages from community and Tom of Finland art to communicate its key messages about injection risks, rewards, and harm reduction strategies. So it's accurate, it's accessible, and it speaks the language of community. So at its core, it sends messages about maximizing pleasure and minimizing harm. And it's a question that the GMSH keeps coming back to in our work with our stakeholders, which is how do we support 2S LGBTQ guys who party and play to have the greatest sex and intimacy with the least amount of harm? So this brings me to our project, which is called Party and Play Your Way, and it represents a suite of interventions and approaches over the next number of years. It's an intentional effort to collaborate and increase the capacity of our alliance organizations to deliver supports that are relevant to guys who P&P, developing health promotion activities that support peer education and center the voices and experiences of gay men who P&P, partnering with research institutions to have more timely and relevant data on P&P that will drive future activities, a focus on systems to ensure that guys who P&P have access to culturally relevant supports across the healthcare system, and approaches that speak the language of P&P, employ culturally relevant terminology and imagery, use content design created and delivered by peers, and operating within a pleasure, positive, harm reduction, and community-led framework. We're implementing 3 strategies to achieve long-term and sustainable objectives, and I think of relevance for this presentation is the creation of access to harm reduction strategies and supplies. I'm really encouraged by the work of our academic colleagues who have been asking tough questions and driving an important research agenda, and it's our hopes through this project that we can contribute to new and exciting and really very much needed understandings about sexualized drug use that move away from simply naming the harms and deficits of gay men who use drugs. One of the central outputs for this project, and we've seen a number of iterations of these mainly in urban centers in the province, like Toronto and Ottawa. So we're excited to pilot the distribution of 3,000 of these kits across our alliance organizations, and it's a partnership with the Ontario Harm Reduction Distribution Program. Party packs, or as one alliance member has suggested calling them tickle trunks, contain a range of supplies that promote risk reduction related to the use of drugs. And what makes these packs unique is that they contain supplies that reflect the nature of sexualized substance use, the intersection of sex and drugs, and the drugs that are used within P&P settings. So of course, we have syringes for those who inject, but also supplies related to the safer dosing of GHB, booty bumping, snorting, smoking, and sexual supplies like fisting gloves, condoms, and lube. Supplies are uniquely color-coded to reduce the risk of sharing. And I think more than just supplies in a box, these represent an intentional effort informed by gay men who P&P to offer something across communities that says, I see you. And it's a relevant tool to inform authentic peer engagement by our alliance organizations. Given that this is a pilot program, we're currently working on a program evaluation survey to be completed by folks who are accessing the kits, and we'll be partnering with David Brennan at the Cruise Lab at the University of Toronto and others. We're looking to understand more fully who is accessing these packs, the drugs they're using, how they're being administered, how guys heard about them, where they access them, and more. So in addition to the supplies in the kits, we'll include a campaign resource that links back to a communications campaign, which is currently in development. And this resource will include key messages related to overdose prevention and response, drug interactions, GHB dose tracking, HIV, hepatitis C, and ST/BBI prevention, psychosis management, and more. The GMSH has supported our alliance organizations in their local assessment of gay men's experiences with organizational harm reduction programs and are currently working on plans to scale up those assessments in communities across Ontario. So it's important that we take our leads from the intended audience of these efforts. And we're also encouraging our alliance organizations to include information in the kits that links to the wraparound services that are offered in their local communities and organizations. You can see some of those wraparound services listed, things like NPEP, PrEP, testing, counseling, peer support, and referrals to other services. So I do want to thank the CBRC for the space in the program dedicated to sexualized substance use in our communities. There's work happening all across the country to scale up interventions, advocate for resources and policy change, and to meaningfully engage guys who party and play. It's challenging work, but I think it's made much easier by the connections that we're able to make in these spaces. And I would say that the questions we're grappling with in Ontario are shared across the country and really around the world in gay men's communities. I want to acknowledge that our party packs were inspired by the activism of gay, bi, queer men in the UK who use drugs, who have distributed thousands of these kits through mail delivery all across Europe. We are working with a number of partners on this project. I want to acknowledge the Ontario Harm Reduction Network, which supports a network of harm reduction programs for their interest and support of this work, the CBRC, our funders at the Ministry of Health, and mostly all of the peers, all of the gay men who P&P who have given so much of their time and experience in supporting us with this work. And so I will leave you with a quote in the words of my colleague and project assistant, Jordan, that in doing work with P&P, we need to engage guys who party and center their voices. So thank you so much.